Welcome to page 63 of Anatomy Coloring Book. This is Dr. Stephen Harkins. We'll be talking about the muscles of the anterior and lateral leg. That's the front of the leg here. And the side of the leg, the outside of the leg here. Let's start with the front of the leg, the anterior leg. We'll start with the Tibialis Anterior. This is the front of the leg. This is the shin area. You can see the tibia underneath here. The bone right here, the shin bone. Tibia. Obviously, it's covered up with muscles, and here's the medial malleolus right there. There's the lateral malleolus of the fibula right there. But let's start with the Tibialis Anterior. Well, it runs along the tibia. I wonder why they call it the Tibialis Anterior. It's on the front of the tibia. It's this muscle right here. This muscle right here, and then you can see its tendon narrows into a tendon right there. And it runs down through the ankle underneath this, what's called a retinaculum, fibrous area that kind of keeps all the tendons contained in there. And it runs right through here, and it attaches, and if you look up here, to the base of the first metatarsal here. This is metatarsal number 1, your big toe. And the navicular bone, the underside of the navicular. You can see it, again, coursing along the front of the shin there, the front of the tibia, narrowing down, sliding in through here, underneath the retinaculum, the superior and inferior extensor retinacula. And then attaching, as I said, wrapping around kind of the front of the foot and attaching on just on the underside of the two attachments, the base of the first metatarsal and the navicular. And hiding just behind the Tibialis Anterior is the Extensor Digitorum Longus. Extensor, I wonder what it does. Well, easy, it extends the toes, and here's the tendon of the Extensor Digitorum Longus. And you can see this tendon branching out here into these long tendons, and you can see these on the top of your foot. And when you lift your toes up, you can see these bumps come out, and these are the tendons of the Extensor Digitorum Longus muscle. The Extensor Hallucis Longus is right here, sneaking kind of underneath and in between those two, and you can see its tendon running through here. Hallucis means big toe. So what do you think it does? Extensor Hallucis Longus. It's a long tendon that extends the big toes. The Extensor Digitorum Longus extended was an extender of the digits, long muscle that extended the digits of the toes. But hallucis does one function only. It extends the big toe only. And underneath that, a smaller little muscle called the Fibularis Tertius, also known as the Peroneus Tertius. It's this little muscle right here. And what it does is it attaches to the base of the fifth metatarsal down here. Comes through here and here, attaches here, and it everts the foot outward. So those are the 4 muscles of the anterior leg: the Tibialis Anterior, the Extensor Digitorum Longus, and the Extensor Hallucis Longus, and the Fibularis or Peroneus Tertius. Now let's talk a little more detail about where they come from, where they originate from, and where they insert. Here is on the left, the attachment sites right here. So this diagram on the left tells us where they attach, where they come from. This muscle, the tibialis anterior, originates from the tibia. It attaches right here to the shin bone, the tibia bone, the front of the tibia. And as we discussed, it comes all the way down here and attaches to the navicular and the base of the first metatarsal. I'm looking up here again, and here it is again, right over here, right there. That's the tibialis anterior attachments. The origin is the tibia. The insertion is the navicular bone and the base of the fifth metatarsal. And you should get to know these words: origin and insertion. Very important, because you need to know where all muscles begin and where they end, and then action. You're going to need to know what they do. And what does, since the tibialis anterior muscle runs from the front of the shin, or the front of the tibia, to the base of the first metatarsal and the navicular, what action do you think it does? Well, it obviously pulls up this way, dorsiflexion, and it pulls your big toes and your foot upward, but also look at this action here. It also inverts. It also brings the foot inward. So it dorsiflex and inverts. It originates at the tibia, inserts at the base of the first metatarsal and the navicular, and the action is that it dorsiflexes and inverts. So you can imagine a tendon coming down here, pulling upward this way. That's the tibialis anterior. The extensor digitorum longus muscle originates partially on the interosseous membrane. It's that membrane in between here, that fibrous sort of ligament that attaches the tibia to the fibula, and also part of the tibia. So it originates all up and down here. We're talking about this muscle here, the extensor digitorum longus, and it inserts, of course, where? At the distal phalanx of all the toes. So it's this muscle here. And imagine a line or a string, well, which there is, it's a tendon, and it attaches to all four of these toes, not to the big toe, just phalanxes, distal phalanxes, toes 1, 2, 3, and 4. So from the fibula, from sort of the medial aspect of the fibula, anterior medial fibula, and the interosseous membrane, down to, that's the origin, and the insertion is the distal phalanx of digits 1, 2, 3, and 4. And of course, what is its action? Well, what it's going to do is it's going to lift the toes upward. The action of the extensor hallucis, or extensor digitorum longus, from here to here, is to dorsiflex the toes. Dorsiflexion, this is upward movement. This upward movement of the toes. Whereas the anterior tibialis dorsiflex the ankle, the extensor digitorum longus dorsiflexes and extends the toes. Now, the extensor hallucis longus originates, the origin is on the fibula, the anterior medial fibula there, and the interosseous membrane as well. And it inserts at the distal phalanx of the big toe, toe number 1. And what does it do? It dorsiflexes the big toe upward and maybe inverts it a little bit, but mostly lifting your big toe upward. That's the job of the extensor hallucis longus. Originating at the fibula and the interosseous membrane and inserting at the base of the first distal phalanx, lifting the big toe upward. The Fibularis Tertius, or the Peroneus Tertius, originates here on the fibula, in the distal shaft of the fibula, and inserts on the shaft of the fifth metatarsal. If you can imagine a string or a tendon going from here to here, what action do you think that Peroneus Tertius or Fibularis Tertius would be responsible for? Well, it everts the foot, or brings the foot to the outside laterally, a lateral movement of the foot. It's an everter. The origin on the distal fibula shaft of the fibula, to the shaft of the fifth metatarsal, and everting the foot outward. This is the medial or inside of the knee. This is the lateral or outside of the knee. So it's a not the big toe side, it's sort of lifting the pinky toe side outward. Eversion. Now, let's move on to the lateral leg, the muscles of the lateral leg. And let's review. So from the front, this is our tibialis anterior muscle, right? Our extensor digitorum longus is underneath there, right? Like here, yeah. Extends these big toes, right? Or the little toes, not the big toe. And now, and then the Fibularis Tertius is kind of sneaking under there. It's kind of hidden in here. Remember, it attaches down here at the fifth metatarsal base. Now let's talk about a new muscle on the side of the leg. And this is the Fibularis Longus, or also known as the Peroneus Longus, P-E-R-O Peroneus Longus. So anytime you see fibularis, you can replace it with the word Peroneus. And in life and in medicine, you'll hear probably mostly Peroneus and not fibularis, so you need to know that. And you can see the Peroneus or Fibularis Longus extending the tendon right on the lateral leg, originating at the head of the fibula and extending the tendon, coming down and passing around the lateral malleolus here, and then inserting right here at the base of the fifth metatarsal. Remember, we had its friend, the Fibularis Peroneus Tertius, starting in here, originating in here at the fibula, and inserting at the metatarsal head, or at the metatarsal shaft, the fifth metatarsal, but the Peroneus Longus inserts right there on the base of the fifth metatarsal. Correction. The Fibularis Longus, the Peroneus Longus, does not attach at the base of the fifth metatarsal. It actually goes around the lateral malleolus onto the retinacula and sneaks underneath the foot and wraps underneath the foot. And look up here, watch what it does. And it wraps around underneath the foot, wrapped around the cuboid bone, groove in the cuboid bone comes underneath the foot and attaches to the navicular bone and the base of the first metatarsal. This is the bottom of the foot, the plantar view. The first metatarsal. So, and what it does is it everts the foot, as you can see right here, the Fibularis Longus or the Peroneus Longus here, coming down here at the bottom, coming under and attaching under here and pulling the foot in this everted direction or outward direction. And here's the Fibularis Longus or Peroneus Longus on the lateral side of the leg. Extending down, tendon down here, and then eventually winding up underneath the foot and attaching underneath the navicular and the base of the first metatarsal. The Fibularis Brevis muscle is right in here, and it is the one that goes down and attaches underneath the retinaculum and attaches to the base of the fifth metatarsal. So two very similar muscles, the Fibularis Brevis and the Fibularis Longus. Longus the tendon goes underneath the foot all the way across to the other side of the foot, the medial side of the foot, attaches to the base of the first metatarsal and the navicular, while the brevis meaning brief or short, it stops short. It does not travel under the foot, and it essentially stops here and inserts to the base of the fifth metatarsal. So let's look closer at the attachment sites. Here we have the attachment point of the Fibularis Longus or the Peroneus Longus muscle, and that's the origin, and the insertion is down here. And of course, as we discussed, it crosses underneath. Let's erase the Peroneus Tertius for one moment. And then we have the Fibularis Peroneus Brevis right here along the lateral side of the fibula, originating there and then inserting here at the base of the fifth metatarsal. You can see that if it originates here and inserts here, it's going to be an everter of the foot. It's going to pull in this direction. Just as you can see, if the Fibularis Longus or Peroneus Longus attaches here and the tendon comes down and under the foot, that it will also pull the foot into eversion, an outward pull of the foot. So, in review here, let's point out the muscles that are everters of the foot. Well, we know these two are the muscles in the lateral compartment, the Fibularis Longus and the Fibularis Brevis, everts. But also the Fibularis Tertius. They're basically all these muscles that lie on this lateral, anterior and lateral side. And of course they would naturally be everters. Now, which muscles are inverters? Well, you've got right here, your inverters and dorsiflexors. Your anterior tibialis here, and you've got your extensor digitorum longus. They will both lift the foot up. The tibialis anterior will invert it, but both will dorsiflex the foot. And of course, here is a closer look at the extensor digitorum longus muscle attaching at the fibula and the interosseous membrane, spreading out to its 4 insertion points, origin and insertion, and your extensor hallucis longus. This is the deep view with the others cut away. You see it's also attaching at the fibula and the interosseous membrane, inserting at the base of the distal phalange of the big toe, and hiding in there behind it, Fibularis Tertius. Catching at the shaft of the 5th metatarsal and everting the foot outward. Of course, the extensor hallucis longus is also a dorsiflexor of the foot, and possibly a little bit of inversion too, along with the tibialis anterior. And that represents the end of page 63, Anatomy Coloring Book. This is Dr. Stephen Herkins.